Thank you for that wonderful introduction. As I said, my name is Julie Mirkin, and I am privileged to serve as the chairperson of this track of care coordination and technology at the World Congress here. My role here today is to really be the hostess with the mostest of Master of Ceremonies. But I couldn't let this opportunity go to give you some of the pearls of wisdom that I've experienced as I've implemented best-in-case, best-in-class practice care coordination endeavors that improve patient outcomes, organizational outcomes, and even staff engagement. And so I'm just going to take about 10 minutes to talk about some pearls of wisdom and lessons learned that I experienced as I've implemented many things across the different organizations I've worked in. And then I'm going to moderate the panel that will be right behind me and introduce the key speakers. So when you think about how can you leverage technology, we're all here at this course to think about not only how are we looking at care coordination in a much more global way, but then how do you leverage technology to improve outcomes? And I was fortunate to work in New York Presbyterian for about 6 years, where they have an entire center for innovation and basically said, be as innovative as you can, and we will support you with technology to back up all of your endeavors, and had the opportunity to implement some pretty interesting things, which some of you may have heard me speak about either here last year or at other avenues. And so in doing that, I think it's important to think about what does it take to really be successful when you're thinking about implementing. And I'm sure all of you in your time here has thought about really great ideas that you've heard from our previous speakers to say, wow, I really need to do that when I go back home. But how do you do that? And the first thing I will tell you is you have to eliminate the silos. Silos are the enemy. And so as you know, in healthcare, we have so many silos. We have silos between the organization, within departments. We have silos when we're talking about health systems from hospital to hospital. I can tell you when I first got to New York Presbyterian, it's an 11-bed hospital. I have the same issue now at Stony Brook. I'm sure you can all understand and resonate with this. Patients within our own health system, when they landed in the ERs, we couldn't read the records. So if a patient went from Columbia University on 175th Street and ended up in Cornell's ER on 61st Street, all in Manhattan, we had no access to their records. Does anyone have that experience? So these silos, we have to work on breaking down the silos. We have to enhance accountability for performance. People have to be held accountable, so you have to set what the expectation for the roles are and then create some level of accountability. Almost most importantly is you have to build relationships that foster collaboration among the healthcare team. And one of the things that we've done very successfully is during interdisciplinary rounds, build those relationships so people feel trust and people feel respect. And then people will speak up and talk about what really needs to happen for the patients. So it's critical to do that. And then understand, what are you trying to fix? Length of stay, readmissions, engagement, both patient and staff are critical, and I think we're all working on different ways of doing that. So it's very important to identify what you're trying to fix. And often what I see in organizations is people come up with solutions that are not really fixing the problem that they're trying to fix. Or they come up with solutions that actually make them further away from the problem that they're trying to fix. And so sometimes things happen. For example, the EMR, that's a perfect example of trying to fix a solution. So we've created through meaningful use all of these amazing EMRs through the country. And so we fixed the problem of everybody documenting on EMR. But I think in some respects we've gone further away from the healthcare team being able to read the EMR. Does anyone have that issue? I used to love to open up a chart and read everyone's notes in order, right? And what my care coordination and social work team members will say is we're in the 7th tab on the left-hand side between 4 other things. Nobody ever reads our stuff. And so you're trying to fix one problem and then you create others. Always look at best-in-class systems to implement. And I think at this conference, you're getting a lot of amazing information on best-in-class systems. The networking is really critical, so I think it's an opportunity to say what's best out there and how can I then implement it. And know that technology supports systems and processes. We can't implement technology successfully unless you have core systems and processes Technology, when you're implementing technology, it's really 80% people and processes and 20% technology. So before you start buying stuff, and I know our vendors may not want to hear this, but this is how you will be successful. Figure out what your systems and processes need to be, and then find those solutions that support them. And it's not a sprint. Anyone that says to you, I can fix this in a year, a month, 6 months, you have to hardwire what you're doing. And then, as I said before, set the default behavior. Once we implement a system and leverage technology, how is everybody supposed to then behave? So one of the lessons I learned, and you've heard this from almost every speaker, is standardization is critical. I know many of you are working on Epic. How many people have Epic in the room? So New York Presbyterian just migrated, or is in the process of migrating, from Allscripts to Epic. And the message is, this is vanilla. So anesthesiologists in 11 different hospitals are going to have to agree, anyone experience this, on one way of documenting anesthesia for patients. It's got to be standardized, because the less standardization, the more variation. And the more variation, the more holes in the Swiss cheese, and the worse the quality. So standardization is critical. People support what they help create. So it's important to engage the staff very early on and ask for their opinions. One of the things that we very successfully created at both NYP and now Stony Brook is we're working on a robust interdisciplinary dashboard that's electronic, that can actually automatically send nudges to the different disciplines to say, PT, we're waiting for you, patient's ready for discharge. Doctor, orthopedic surgeon, we're waiting for you for a consult, patient is waiting 1 day. But when we implemented those things, we got the key team players in the room and asked them, what does this look like to you? How do you want us to design it? And because they help to support the creation of it, they support the implementation of it. Also, culture eats strategy for lunch. If you don't create a great culture where people understand, connect to purpose and why they're doing things, the strategy will not work. For here, take the time to network and learn from each other. And as I've been going around, I see a lot of networking going on. We have experts in the room from all different organizations, different types of care. We have novice to experts in the room. Network, take this opportunity to network. This is an organization, the World Congress, where we really like to collaborate and share best practices. So tap into each other if you have questions. And have fun. We're in Atlanta, for God's sakes. So coming from New York, of course I wore my white pants because I assumed because we're south, the temperature would be about 80 degrees. I didn't look at the Weather Channel. But it's Atlanta. So have fun in Atlanta, have fun at the conference, network, mingle, enjoy what you're doing. And I'm going to challenge you to take this away. Pick one thing that you heard in the yesterday, today, and tomorrow, and say, you know what? I am going to work on implementing that in my organization. When I sat for the last day and a half listening to all the speakers, I could have implemented 10 different things. I was so enthralled. And when I sit in these meetings, my head's spinning. I have to do that, I have to do that, I have to do that. And then what happens is you go back to your organizations after being inspired, and what happens? Reality, right? So think about one thing that you can take away from this organizational conference and bring it back to improve the care in your hospitals or your health systems. And that will define success. So those are my pearls of wisdom. Thank you for listening. And now I'm going to take the great opportunity to introduce our speakers for our next session.